Good day, students. Class is back in session. And this video tutorial marks a turning point for us. I guess it's similar to graduating from one grade level to the next after summer break. And I say this because thus far in this menopause education, I've focused on the diseases that are a result of estrogen deficiency at the time of menopause. We haven't yet discussed the symptoms that are characteristic of menopause, and I presented the diseases first for several reasons. The first and most important is the fact that the diseases have a much more significant impact on your life than any of the symptoms. Second, some women don't even have symptoms, but all women are at risk for the diseases. Third, the symptoms are commonly temporary, whereas the diseases are permanent. Fourth, the symptoms get your attention by their annoying impact on your quality of life, and the diseases are silent but deadly and can end your life. And fifth, most women have heard about the symptoms, but most are completely clueless about the diseases. I guess you could sum this up by saying that women who don't have symptoms or who don't know about the diseases fall prey to what I call the hooray today, sorrow tomorrow phenomenon. In other words, they're so focused on the small things that they're blind to the big things. You know, there's a song by Colin Ray entitled "That Was a River." It's a song about love, not about menopause or hormones. But the lyrics are apropos for our focus on menopause and hormones. Because the lyrics say, that was a river, this is the ocean. Well, when it comes to menopause, the symptoms are merely a river while the diseases are the ocean. But now that we've discussed the diseases, it's time to shift our focus to all the symptoms, and there are many. But you know, I won't just present the symptoms randomly. I mean, heck, I don't know how to do anything randomly. So we'll address the symptoms in the order in which they typically occur as you transition from pre-menopause to peri-menopause to post-menopause. Now, some of this will serve as somewhat of a review for those of you who have watched all my videos in order, like you're supposed to. But it will also encompass more than you've already learned. And you will not find this overview of symptoms broken down by hormonal phases in my book. This video presentation in this format is a bonus. For purposes of discussion, I'll divide the hormonal phases into 4 time frames and 4 hormones. This particular video will present the big picture, and that way you'll understand why you have certain symptoms at certain times. Future videos will delve into each phase and the symptoms that are due to each hormone individually. And you know that I'll dedicate the appropriate quantity of time to each individual symptom of menopause. So here's a chart that represents the timeline of events spanning from your pre-menopausal life all the way through your post-menopausal life. What you see here is a chart that we will utilize over and over again as we address the phases of hormonal changes throughout your lifetime. Across the top row, you see the 3 phases of your reproductive life: pre-menopause, peri-menopause, and post-menopause. Listed in the first column, you see the reproductive hormones that change during the 3 phases of your reproductive life. Estrogen and progesterone together in lavender, progesterone alone in yellow, oxytocin in green, estrogen alone in pink, and testosterone in blue. Now, the reason this chart is helpful is because it depicts everything on one page, and it's organized in accordance with the order of events in your own transition from premenopause through perimenopause and on to postmenopause. Since our goal today is to get the big picture, I'm going to explain how each of these hormones changes as you progress through these phases. So let's start with pre-menopause. Pre-menopause is the big, long stretch of time between puberty and perimenopause. It lasts for up to 40 years or so. It's when you think you'll be young and beautiful forever. Premenopause is when your ovaries function as egg and hormone factories, and their sole purpose is to provide the ingredients for pregnancy. Estrogen is for ovulation of an unfertilized egg, and progesterone is for support of a fertilized egg. So during premenopause, you have menstrual period after menstrual period after menstrual period, punctuated here and there by pregnancies. Premenopause is governed entirely by your hormone cycles. And the hormone cycles exist as a result of the hormones listed on our chart. So let's designate what happens with each hormone. The first row of our chart lists estrogen plus progesterone. And the only reason we have a row bearing these two hormones together instead of each hormone alone is because of premenopause. Throughout all the years you have cycles, your estrogen and progesterone together perform somewhat of a dance that creates those cycles. So estrogen and progesterone act together throughout your entire reproductive life. You've seen this homemade Play-Doh graph of these hormones a whole bunch of times. The pink line here is estrogen. The multicolored line here is progesterone. And the blue line here is testosterone, but we're going to address it later. For now, focus on only the estrogen and progesterone. Let me preface everything I say by emphasizing the fact that while these two hormones rise and fall to create your menstrual cycles, neither hormone is ever zero during premenopause. During premenopause, you have a baseline quantity of each of these two hormones at all times. They are plentiful. In the first half of each 28-day menstrual cycle, your estrogen rises. And when I say it rises, I mean it really rises. Your estrogen levels rise by 10 times during a single menstrual cycle. And you literally get high on estrogen. Most women feel wonderful when their estrogen is high. They function at their very, very best then. They're energetic. Their brain is sharp. Their weight is stable. And they feel normal. Overall, estrogen makes most of us feel spunky. How in the world women have let anyone demonize their estrogen is beyond me. When you demonize your hormone, you sabotage your own. Well, next you enter the second half of your menstrual cycle, and that's when you start feeling a bit off. This off feeling is entirely due to progesterone. Remember, the very word progesterone means hormone in support of pregnancy. Pro means in support of. Gest means gestation or pregnancy. Own means hormone. The only reason you have menstrual cycles is to enable you to get pregnant. So estrogen's job is to make an egg ovulate from your ovary. Progesterone's job is to create a nice baby carriage in your uterus should that egg get fertilized. So progesterone paves the way for pregnancy. As such, you start feeling a bit less than optimal. You see, as far as Mother Nature is concerned, once you're pregnant, you are nothing but an incubator. So you start feeling sluggish and lazy simply because that's what's best for the baby. If you're sluggish and lazy, you'll be a couch potato all day. And if you're a couch potato all day, the baby can utilize more of the calories you eat to get off to a good start. So progesterone makes most of us feel lousy. Erroneously, some people refer to progesterone as the feel-good hormone. That is just so contrary to fact for the vast majority of women. Most women notice that they are less energetic in the second half of their menstrual cycle. Their brain is not as sharp. They notice a pound or two of weight gain, and they feel bloated. These sensations are progressive over the course of the second half of your cycle. And about 3 days before your period, they become very noticeable along with some other symptoms. You feel drowsy. You even feel a bit depressed. You crave carbs and sugar, and your breasts are tender. Altogether, this is what we call premenstrual syndrome, or PMS. So overall, progesterone makes us feel dumpy. Of course, we women are not robots. So there are women for whom progesterone does not produce a lousy feeling. In fact, some women love the way progesterone makes them feel. The bottom line is that the combination of estrogen plus progesterone during premenopause causes you to feel differently at various times during your cycle. So on our chart, let's just simplify this by indicating that estrogen makes us feel spunky and progesterone makes us feel dumpy. Now let me point out that some of the hormones listed individually are not applicable in our pre-menopause row on this chart. Since we've already addressed estrogen and progesterone together, we will not have anything more to add in the individual cells for them. And likewise, we'll be designating non-applicability of certain cells to some of the other hormone phases when we get to them. For now, let's designate not applicable for estrogen and progesterone individually during pre-menopause. As you can see, the very fact that estrogen and progesterone function as partners in creating your menstrual cycles means that they tend to keep one another in check. So it is not common to have an excess of either unless you have a disease process causing the excess. Since my goal is to ensure that you can always make sense of your symptoms, I'll give you lists of the symptoms of both estrogen and progesterone excess. But you should know that excesses of estrogen are rare, except during pregnancy. And notice that the proper term here is estrogen excess. It is not estrogen dominance. The term estrogen dominance is completely asinine. We're women. Our hormone is estrogen. So automatically all women are estrogen dominant, just as all men are testosterone dominant. So stop using the asinine term estrogen dominant. It's nothing but a marketing term that was designed to get women to buy progesterone instead of estrogen. But instead of that, it misled women into thinking that estrogen is some kind of demonic hormone. Estrogen is no more demonic for women than testosterone is for men. If only women worried as much about estrogen deficiency as they do about estrogen dominance, they'd all be a lot better off. So please understand that we are talking about estrogen excess, not estrogen dominance. And here are the symptoms typical of estrogen excess. most of which women associate with pregnancy. Heavy periods, unless you're pregnant, nausea, vomiting, yeast infections, leg cramps, cravings, breast tenderness, and bloating. Well, what about progesterone excess? Progesterone excess is typical of both pregnancy and premenstrual syndrome, also known as PMS. In fact, most of the symptoms women associate with both pregnancy and PMS are due primarily to progesterone. Here are the symptoms of progesterone excess: PMS, weight gain, fatigue, depression, drowsiness, cravings, breast tenderness, and bloating. So now you know why PMS is so unpleasant. It's due to progesterone. Now, our next hormone to address in the pre-menopause column is oxytocin. Oxytocin is the loving or bonding hormone. It's the glue. It made you want to find a boyfriend, fall in love, get married, have a baby, etc. It also made you love doing all the things that made your loved ones happy. You made the dinners they liked. You went on vacations that you hate just because they enjoyed them. You did whatever it took to bond with everybody. Oxytocin was the glue that made you do so. Well, during the pre-menopause, you have oodles and oodles of oxytocin. It's what made you so loving. And you have steady high levels of it all the time. It's there in abundance, making you abundantly bonded to your family. So regardless of whether you're in the estrogen-induced spunky first half of your menstrual cycle or the progesterone-induced dumpy second half of your menstrual cycle, your oxytocin is plentiful and you are very loving. So on our chart, we'll just put loving in the oxytocin cell of the pre-menopause column. And we needn't create a list of symptoms of excess oxytocin because it's anything that constitutes being loving. And finally, for premenopause, we have testosterone. Now, you already know that testosterone is Papa Bear's hormone. Testosterone is to men what estrogen is to women, and testicles are to men what ovaries are to women. If estrogen is poison, then testosterone is too. So testosterone is produced by a man's testicle. It's what gives him a strong sex drive. Well, we're talking about women, and testosterone is one of the hormones listed on our chart. So what's its role for a woman? Well, women have steadily low testosterone levels throughout each menstrual cycle. That is, except for one particular time, just before ovulation. Yep, just before you spew out an egg, your testosterone surges for just a couple of days. It's really just a blip on the 28-day cycle. And it serves the purpose of boosting your sex drive just in time to fertilize an egg. So its ultimate effect is that it makes you horny. Convenient, isn't it? It's like instant anti-birth control. And this little monthly blip during your pre-menopausal life constitutes neither an excess nor a deficiency of testosterone. So we'll put pre-ovulatory horny on our chart for testosterone in the pre-menopause column. So what we have during pre-menopause is a coordinated dance between estrogen and progesterone swaying you from spunky to dumpy, a constant level of oxytocin making you lovey, and a pre-ovulatory surge of testosterone making you horny. Then, after about 35 or 40 years in premenopause, you head into perimenopause. This is the transition phase. It's when all the things that come into play at puberty reverse themselves. Of course, none of these transitions occurs instantaneously. Instead, it's as if they peter out little by little, turning off your reproductive life slowly over time. So this phase is the most chaotic of all. But I want you to really understand what's happening overall. So let's go through each of the hormones on our chart and indicate how each changes during perimenopause. Well, first, we have the combination of estrogen plus progesterone together. As you know, both of these hormones were plentiful during premenopause, and they interacted in a coordinated, predictable way to bring about your regular monthly cycles. Earlier, I told you that the sole purpose of estrogen and progesterone together is to provide the ingredients for pregnancy. Estrogen is for ovulation of an unfertilized egg, and progesterone is for the support of a fertilized egg. Well, the very purpose of perimenopause is to bring all of that to an end. So the first thing I'll specify is that perimenopause throws a wrench into the discussion of estrogen and progesterone together. Instead of working together as a happy couple, it's as if they have a very rocky breakup. And that's what causes all the chaos. So we'll insert a not applicable designation in the first row of our chart for the perimenopause column. So instead of discussing estrogen and progesterone together as a couple, we'll address them individually for perimenopause. And since perimenopause serves to end your ability to get pregnant, the first hormone that changes is progesterone. It's what causes the breakup. So the real driver of perimenopause is progesterone. Let's address progesterone all by itself first. Then we'll designate what happens to estrogen as a result of the changes in progesterone. The very definition of perimenopause is loss of progesterone. This is because progesterone's only job is to support a pregnancy. So the first thing that happens is loss of progesterone. And again, this does not happen suddenly. Instead of occurring in a smooth, predictable manner, it occurs in a clumsy, unpredictable manner. And instead of occurring suddenly, it occurs gradually. Here's my Play-Doh representation of perimenopause, this phase here. It's the portion of this graph that shows progesterone decreasing while estrogen is still somewhat high. So what are the symptoms of progesterone deficiency that you typically have during perimenopause? Well, they include all the following: irregular periods, heavy periods, anxiety, and headaches. So the very first thing to indicate on our chart is the gradual loss of progesterone during perimenopause. Well, since estrogen and progesterone are supposed to be a couple performing a coordinated dance as partners, the loss of progesterone creates all sorts of chaos. So now, let's address what happens to estrogen without its beloved dance partner during perimenopause. Imagine a couple that always dances together. Well, if one of these dance partners suddenly disappears, what happens to the remaining dance partner? Most likely the remaining lone partner will be a little bit discombobulated as to how to dance alone, right? Well, that's precisely what happens to estrogen when it finds itself all alone without its beloved progesterone as a partner. And this is compounded by the fact that instead of just disappearing all at once, progesterone disappears in an irregular, unpredictable, on and off manner. So poor estrogen doesn't know what to expect from 1 minute or 1 day to the next. And the overall result is complete and utter chaos. If you were to check your estrogen and progesterone levels every day during perimenopause, you would be shocked. They'd look like this. Estrogen is in orange, progesterone is in blue. And as you can see, it really doesn't matter which is which because they are both complete roller coasters. But overall, your progesterone is slowly disappearing. Wild, isn't it? And wild is exactly how perimenopause makes you feel. This is why you start having the roller coaster of symptoms that are typical of perimenopause. It's why it's such a chaotic time. And it's also why I tell you that labs are worthless. All labs are a single snapshot in time. But if your hormones are roller coastering up and down every day, how in the world can drawing labs at any given time tell you anything meaningful? It can't. So don't waste your time, your blood, or your money. The symptoms of perimenopause can be as varied as these levels of estrogen and progesterone. All of the following are typical: absent periods, irregular periods, heavy periods, PMS, anxiety, hot flashes, night sweats, heart palpitations, insomnia, fatigue, forgetfulness, mood swings, irritability, depression, joint pain and stiffness, dry skin, hair loss, vaginal dryness, urinary incontinence, urinary tract infections, weight gain, decreased sex drive, headache, nausea, vomiting, leg cramps, yeast infections, drowsiness, cravings, breast tenderness, bloating. That's a long list. And not only is it a long list, it's also an ever-changing list. There is nothing consistent from day to day with regard to these symptoms. Some of them can come and go. Some of them can worsen over time. Some of them can lessen over time. Some of them can last for the rest of your life. The problem is that you cannot predict anything about any of them. Anything is possible, but it's all pretty miserable. And this is what makes perimenopause the part of the menopause transition on which most people focus entirely. Perimenopause can last for 2 to 10 years. It's a process, and the entire process is fraught with chaos. People often use the term raging hormones. Well, perimenopause is a time of both waning hormones and raging hormones. And the most chaotic thing of all about perimenopause is that you can still get pregnant. You see, ovulation is completely unpredictable. With the roller coastering of both estrogen and progesterone, you can even ovulate 2 eggs in a single cycle. So you are more likely to get pregnant with twins. Anything is possible. Not ovulating at all. Ovulating sometimes and not others. Or ovulating 2 eggs instead of just 1. So on our chart, let's add to our row for progesterone during perimenopause. In addition to its gradual loss, let's indicate that it is chaotic. And let's also indicate that estrogen is chaotic because progesterone is chaotic. Okay, our next hormone to address during perimenopause is oxytocin. Recall that it is the bonding hormone that made you so loving throughout premenopause. Well, my dears, perimenopause changes that. That's right. You lose the oxytocin that made you so loving. Poof! All gone. And guess what happens when you lose it? You lose your loving feelings along with it. So you go from loving to loathing. Gone are the days when you'll do the things that made everybody else happy. Gone is your interest in putting up holiday decorations or making big meals. Gone is your need to stay married. Gone is your desire to solve everybody else's problems. Oxytocin loss makes you focus on yourself first instead of focusing on everybody else first. In essence, you go from loving to loathing. So let's indicate this on our chart. And again, we don't need to make a list of what constitutes loathing. Loathing includes loathing everybody and everything. Well, that leaves us with just one more hormone on the perimenopause phase of the cycle. Testosterone. Well, what happens to it? Nothing. That's right. Even though your progesterone starts disappearing and your estrogen becomes completely chaotic and your oxytocin wanes, your testosterone remains. And since testosterone isn't muted by estrogen and progesterone, you start having symptoms of testosterone excess. These include weight gain, mood swings, hair loss, deepening voice, acne, whiskers, aggression, anger, and increased sex drive. So your weight gain and moodiness actually just get worse. And you start having symptoms typical of males, in addition to the long list of symptoms you already had from the chaotic behaviors of estrogen and progesterone. Notice that the last symptom of testosterone excess is increased sex drive. So you still have normal quantities of testosterone, and you're still horny. Additionally, you still have that blip of increased testosterone just before you would normally ovulate. So you're more likely to have sex just in time to get pregnant with twins. So we'll designate that as hyper horny on our chart. Okay, after 2 to 10 years of perimenopause, you finally reach post-menopause. Now, by the time you're post-menopausal, your progesterone is long gone, and there is no dance between estrogen and progesterone. They're both just basically zero. And your oxytocin is already kaput too. You are firmly enmeshed in your loathing of just about everybody and everything. So the first thing we'll indicate on our chart is that the first 2 rows are not applicable. And our 3rd row for oxytocin is still continuing to carry on loathing. And since progesterone is finally completely absent, without it, your estrogen has dwindled too. The very definition of postmenopause is the loss of estrogen. So postmenopause is a state of estrogen deficiency. It is when you are completely estranged from your estrogen. Some of the symptoms you've had during perimenopause were due to inadequate quantities of estrogen, but that was before your estrogen disappeared completely. Now at postmenopause, with the complete disappearance of estrogen, you have more and more symptoms of estrogen deficiency, and they become more and more severe. They include all the following: anxiety, hot flashes, night sweats, heart palpitations, insomnia, fatigue, forgetfulness, mood swings, irritability, depression, joint pain and stiffness, dry skin, hair loss, vaginal dryness, urinary tract infections, urinary incontinence, weight gain, decreased sex drive, and headaches. These symptoms constitute your body's way of telling you that it does not have its beloved hormone estrogen that was your fountain of youth. So once again, you see that estrogen is not a sin. Your body loved it and then it was gone. And since you will be postmenopausal for the rest of your life, these symptoms are likely to be permanent for the rest of your life. They may not bother you as much as they once did, either because you get used to them or because you think that they're a natural or normal part of aging. But there's nothing natural or normal about them whatsoever. They are symptoms of a hormone deficiency. So when it comes to estrogen, the more the merrier. But somehow women have been led to believe that it's the more the scarier. So now we'll add symptoms of estrogen deficiency in the postmenopausal row of our chart for estrogen. And finally, we have testosterone during postmenopause. Well, as you can see, testosterone eventually does decrease, but it usually lags behind the loss of estrogen by about 2 years. So if you're like most women, your testosterone drops to imperceptible levels about 2 years after you become postmenopausal. And that's when you start noticing symptoms of testosterone deficiency. These include lack of energy, absent sex drive, difficulty having an orgasm, thinning of pubic hair, decreased muscle mass, decreased feelings of well-being, and depression. Of course, before it dwindled, your testosterone was the only hormone remaining to provide any interest in sex whatsoever. Without it, your love life is over. And since postmenopause occurs at about age 50 and testosterone decreases at about age 52, chances are that your love life will be in the loo at 52. Over and over again, postmenopausal women tell me that they don't care if they ever have sex again. So loss of testosterone results in complete absence of your sex drive. So let's complete our chart. As you look at this chart, you see that the 3 phases of premenopause, perimenopause, and postmenopause are quite different. You go from pulsating estrogen and progesterone during premenopause to plummeting progesterone and honorary oxytocin during perimenopause, to exiting estrogen and tumbling testosterone during postmenopause. And because all these phases are different, we will need to address them individually with regard to the symptoms that are typical of each. This is why I wanted to present this broad perspective first. Doing so helps you make sense of the symptoms you might have at any given time during your reproductive and post-reproductive life. If we summarize these phases in terms of the symptoms for deficiency or excess of each hormone, we get this. This simple chart just shows our 3 main sex hormones: progesterone in yellow, estrogen in pink, and testosterone in blue. I've put them in the order in which they disappear. And there are 2 rows, one for symptoms of deficiency and one for symptoms of excess. Notice that some symptoms can be due to more than one hormone. This is one of the reasons why hormonal issues can be so confusing. And no hormone works in a vacuum. Another way to say this is that hormones are not lone rangers. No hormone acts alone. And that just makes things even more confusing. When you still have cycles, or when you transition into the peri- or postmenopausal phases of your life, these hormonal changes occur gradually. So various symptoms come and go, worsen and improve, etc. Speaking of cycles, notice that pre-menopause and perimenopause involve cycles, while post-menopause does not. So if we add a row to our chart just for cycles, our chart would look like this. Pre-menopause is characterized by regular, predictable cycles. Perimenopause is characterized by irregular, unpredictable cycles. And postmenopause is characterized by absent cycles. If we add yet another row for the number of days you feel dumpy in any given month of each phase, things get really interesting. So now you see that I've designated 3 to 9 dumpy days out of 28 for pre-menopause, 10 to 28 dumpy days out of 28 for peri-menopause, and 28 dumpy days out of 28 for post-menopause. I guess you could say that pre-menopause makes you pleasant, peri-menopause makes you pissy, and post-menopause makes you plain old mean. Of course, this pertains to the way things are likely to be without my menopause education. If you have this education, you can make all your days good days, regardless of which phase you're in. This is why my dream is for all women to get this education in their 20s. So now that you see the big picture of how things change from phase to phase, we'll delve into each one individually. And we'll do so chronologically, of course. So this is all for today. And next week, we'll discuss pre-menopausal cycles and the symptoms that occur on a cyclic basis. In the meantime, please go to menopausetailor.me to schedule that consultation that you always wanted and needed. I do them with women in all phases and also all over the world. Be sure to subscribe here to my channel and my newsletter, and be sure to follow me on social media. I'm on all the platforms. So until next week, bye my dears.